goal of the task force is saving lives using rapidly deployable solutions against COVID-19. And with over 17.3 million confirmed cases and 670,000 deaths worldwide, COVID-19 is here to stay. You can see that US is number one, followed by Brazil. India is number three, Russia, South Africa, Mexico. These are all next in line. So now we all know that COVID-19, like measles, HIV, chickenpox, is an endemic, stubbornly resisting efforts to stamp the disease. So COVID-19 is an endemic, likely would not return. So be very careful. And some even have speculated that everyone is going to know someone who got infected from this virus in future. And the question is, how do we live safely? Safely. That's the big question. And this is just the news from yesterday. In the last couple of days, 1,500 COVID-19 deaths were reported in US, the most in a single day since May, actually. And former GOP president, hopeful, Herman Cain, died of COVID-19. So this is and these are some well-known people, but there are several folks that are dying. They're just part of this over 1,500 number, actually. But these are some of these where family members, brothers, sisters, fathers, grandfathers, children of our own global community. And then personally, I have several stories to share because I'm connected with the global community, and everybody is sharing their thoughts of losing their loved ones. And I'm humbled, and every day I'm growing to be more humbled by existence of human beings as a community. I think I think it's called common enemy. So the virus is a common enemy against humanity. I think we all should come together. And there is no war, but there is I think we have to be intelligent. That's how human race has survived through many pandemics. So we have to intelligently handle this disease. And one thing I would like to point out, that the CEO Vas Narasimha, of Novartis, who is very well versed in vaccine development, he said, my own experience in vaccine teaches me that it is difficult to de novo build and scale expertise to be able to develop large-scale vaccines successfully. So I think those who have vaccine hopes for vaccine, I think this a lot of folks in the field know that there are challenges, and this brings to this is a precedent to the projects, some of the projects that will be presenting at the hackathon. So a lot of people ask me this question: hey, Prasun, why do you think this virus is so infectious? Why other viruses, SARS, MERS, were not that effective? I can tell them all about the science, but I think what analogy that I learned, and if you think about a ball, right, a rubber ball, and a surface, you just throw the ball and the ball bounces, right? Bounces. So the same thing happens in the immune system, in the body. So if you consider virus as a rubber ball, and virus actually bounces on the cells to cells until it finds a anchor point, right? And sometimes the cell can engulf and dissolve those viruses and get rid of them during the process. But with COVID-19, imagine a scenario where you have a ball and you are throwing in a mud. What happens? The ball will go and it just gets stuck, right? Because the mud directly, it just basically, there is an anchor. So similarly, I think, so SARS-CoV-2 has ACE2 receptor binding sites on the spike proteins that are red spike proteins, that are part of the corona of this virus. So that's why it's called coronavirus, because it has a corona-like uh, uh, like kings and queens, they used to wear a corona. So so ACE2 receptor actually binds, and it is on several organs in human body. It binds readily to SARS-CoV virus, and the virus is internalized, where it releases its RNA and uses as well as the proteins, and then it uses body's replication machinery to divide and replicate itself. It also hacks the Golgi complex, and then it makes copies of itself, and those are shuttled out by vesicular transport to infect other cells. So this is so hope that explained why this virus is such a challenge and so infective. And there are ways to categorize the disease, and there are now 4 different categories. One is subclinical, and so this is the folks who have the virus but have no symptoms. The second category is infections in the upper respiratory tract. So this is associated with fever, cough, headache, and conjunctivitis. And the third stage is development of flu-like symptoms. So it's large. This is the largest group pertaining to hospital visits. And are testing positive for COVID-19, and these are mostly folks have flu-like symptoms, cough, and the last is usually is very severe when they develop illness, which is called ARDS, or pneumonia-like symptoms, where they have breathing difficulty. There's also a phenomenon called happy hypoxia, where the lungs become dysfunctional, and the patient doesn't, some parts of the lungs, they get dysfunctional, but the still lungs, overall the lung is functional. And then eventually we have when the patient will only know that this has happening when the functionality of a lung is severely impacted. So when the last last part of the cell is impacted. So the last part of the cell. So I think to this video will give you a guide what I'm talking about. So basically, this is a patient who is impacted by COVID-19 in the stage 4, and you can see the yellow, all the yellow, yellow. If it yeah, so these are all yellow are infections due to COVID-19, and so usually what COVID-19 does is it just infects your, I think almost 98% of cases, it infects the airway channels, and most of the times body will take care of it. However, in I think 6% patients, and the virus is successful in basically blocking the gas exchange, and that's what is happening. You can see the yellow at the end of all these airway channels, they're all blocked. So the gas exchange, so lung will not be able to breathe. And the happy hypoxia is when all these will be, so sometimes patient will not have symptoms unless all of these were blocked. So that's when they get immediately hospitalized, and this is where they need aids to breathe. So just to summarize what we have learned so far. So like I said, almost 94%, this is from a Wuhan data, shows that up to 94% of patients will recover. However, about 6% of the folks will develop severe disease, which will impact not only the T cells, which is very concerning because virus targets T cells. HIV also targets T cells. Also at this stage, release, there are a lot of cytokine response, as well as lymphopenia is elicited, and it may lead to vasoconstriction and multi-organ failure and death of a person. So and so American Association of Precision Medicine, and as I mentioned to you, the goal is to accelerate the field of precision medicine through research, education, communication, collaboration to foster new medical breakthroughs. We are at AAPM.health, and one of our major goals is to facilitate the dialogue between the four P's of precision medicine, that is patients, providers, public health planners, and payers, to work together to achieve the goal of delivering improved outcomes. And in the dawn of the dawn of this infections, I think very early, as AAPM has community all over the world, we were able to sense the infections very early on. And mid-January, AAPM started recruiting all the members in their network to build a global network of experts in clinical, scientific, technical, and advocacy backgrounds to come together to focus on delivering and disseminating strategies for COVID-19. Thank you all for just being here. And what I have learned is that if we all, so the crisis has made us all isolated. We are all isolated, but I think what I have learned is that, I think there is a way to build. So we have two choices. One is just, spend your life isolated, or come together and be part of this amazing community and make a difference. And I think what each of us will be judged, and how our coming generations will judge, not how we stayed at home and did all the necessary steps to not get infected, but how we all came together despite this, despite of all the challenges of the social distancing, and made solutions that transformed this world.